Hey everyone, Milkman Al here. Today we're going to be talking about repetitive stress injuries. Most people are pretty familiar with that, most likely, but you may not know some of the options that are available to treat it, and we'll talk for about everything from conservative options all the way up through surgery. Now, I've got some meat on the smoker and some bourbon to drink, so I'm going to finish this faster than I finished during Amaranth's last stream. So, hang with me, it's going to be a quick ride. Now, you know that classic joke that goes something along the lines of a patient comes into the doctor and says, "Hey, doc, it hurts when I do this." And the doc says, "Okay, don't do that." Well, that's the gist of this talk. But what if you can't stop doing that? What if the thing that's causing your injury is necessary to your daily life? It's something that you can't avoid. That's going to be the thrust of the talk. So before we dive right into it, don't forget to like and subscribe. And you can follow me live 8 to 10 p.m. Central on Wednesdays and Sundays. Also, come and join our Discord for chat all the time. So, first, we should talk about what a repetitive stress injury actually is. So, most people know repetitive stress injuries by the more specific terms that affect certain joints, like carpal tunnel syndrome, tennis elbow, shin splints, things like that. Um, but they're all sort of different sides of the same coin, more or less, and you can kind of treat them the same, and that is you rice it. So any basic orthopedic injury that's not, like a broken bone or something like that, or a muscle tear, you treat with rice. And what that is rest, ice, compression, elevation. Now, obviously, you can't, like, compress or elevate your back, for instance, very well, or your neck. So those are not universal things that are available, but for the most part, that's kind of the guidelines that you start with. So in any event, the best thing that you can do is stop using the afflicted joint or extremity. But again, what if you're a coder and you have to type all day? What if you're a runner and you've got a marathon coming up? Like, maybe you can't stop running. You can just treat your symptoms and push through. What if Amaranth just updated her OnlyFans? I mean, these are serious problems here. So the first thing to realize is that rest doesn't necessarily mean stop entirely. Rest can just mean take breaks. Take stretch breaks, like, especially for nerds like me. If you rock out a hardcore gaming session and your hand hurts, stop. Stop and stretch your hands, stretch your fingers back and forth. Do the same thing with your wrists. Life is good. So those of you who have followed me and have followed my stream know that I am all about conservative measures to control anything. Like, yeah, it's true that I'm in the operating room all the time fixing people for injuries like these. Actually, carpal tunnel syndrome is very common, and carpal tunnel surgery is a really, really common way to treat it because it's an easy surgery, it's very low risk, and, works well. So, that said, it's still surgery, and, anytime that you invite somebody to cut on you, you open the possibility to things like infection or scar tissue that makes the problem worse, or just, things like that. Like, those are unlikely complications, but the chance is zero if you have no surgery. In any event, like I said, I'm all about doing what you can outside of medical intervention to fix pretty much any problem that you have. So this is going to just kind of cover some basic things that you can do at home if you have one of these very common repetitive stress injuries. So again, first and best thing to do is rest. Take breaks, stretch, keep your, afflicted spot as limber as you possibly can. Ice is helpful because what repetitive stress injury actually is kind of like localized inflammation at a certain point that sort of spirals. Like, you get in this positive feedback loop where you have inflammation, the muscle is sore, the tendon is sore. You can be anything from arthritis to tendonitis. A torn muscle, like a partial sprain or something like that. But in any event, ice can help with that inflammation and sort of calm down both the cause and the symptoms of what you're having. So ice is very effective. Again, compression, helpful for the same reasons. Elevation also decreases blood flow to, whatever thing is hurting you, say your wrist or your shin, for whatever you're doing. But again, that it's not always possible to elevate or compress things. Other things that you can do, there are an increasing amount of ergonomic products available for you. So be conscious of your positioning. Good posture, good stride, better form for, like, tennis or golf or whatever that you're doing that's affecting your joint. form is really important. So, like, you can't really tell right now, but I have my desk set up so that my elbows are resting on the armrests. And they're resting on the armrests at all times because holding your arm like this is really awkward. Your shoulder isn't really built to do that for long periods of time. So if you can unburden your shoulder and unburden your hands, that will help your repetitive stress injuries significantly. So my hands always are resting on my keyboard. They're resting. I have like a wrist pad on my mouse pad that my hands rest on. You want everything neutral as possible. So I have a vertical mouse, as you can see here, because that's a more natural position for your hand. Like holding something like this is more natural than doing this, right? Because you kind of have to necessarily pronate your wrist, and that's not like as natural or effortless of a position as just because your hand's kind of like vertical rather than horizontal normally. If that makes sense. Anyway, keyboards, same way. There's really good ergonomic keyboards that you can get that allow your hands to be more neutral, and that will really, really help you out in the long run. Standing desks are becoming a more common thing in the household. So if your back hurts you or your hips or something are hurting you, standing in good posture can really help that out. There are also chairs that are backless, and they're designed to hold you upright so you kind of strengthen your core muscles. And core muscle strengthening is actually a really good treatment for pretty much any type of back pain. So that's a very helpful thing to do. Is it may not seem like you're resting, but actually when you account for your form and your body position, you are in fact resting the joints, muscles or whatever that's hurting you. So say you're doing all of those things. You have all the cool ergonomic gadgets, you're resting as much as you can, you're stretching and all that, and you're still having problems. What do you do? So we're just now coming out of the opioid epidemic, so please don't interpret this as me recommending that you take narcotics, but there are very effective painkillers, namely Tylenol and ibuprofen or other non-steroidal anti-inflammatory drugs that you can take over the counter that are really, really useful. So combining Tylenol with like ibuprofen is a nice way to take down your pain a little bit. And ibuprofen is also, as its drug class would suggest, a non-steroidal anti-inflammatory. So it decreases inflammation and helps you sort of get out of that vicious cycle that I mentioned earlier with inflammation and worsening symptoms. So that's a really nice thing to do for yourself. You don't really want to be taking ibuprofen chronically because it's pretty hard on your GI tract. You can give yourself ulcers and stuff like that. But if you're just trying to like get over an acute phase of this repetitive stress injury, it's really helpful. And now, depending on how bad your RSI is, you might need to actually see a doctor about it. You might need to consult with them. And sometimes you need to do that to get things like braces, which are very helpful. They tend to unload the problematic tendons and joints. So that can be another form of sort of like actively resting your joints. You can maintain your quality of life and your activity level, but the joint itself that's affected is not taking quite the load that it was before. So maybe you can heal up that way. Sometimes for the more like advanced or intense braces, you'll need a prescription for those. But a lot of them are available just in your drugstore, like simple wrist braces and things like that. You can get at like CVS or Walgreens or whatever. So those are good things to try before, you really kind of haul off and start getting true medical intervention. The thing, like I said, that you're really trying to avoid is surgery. Because, again, anytime somebody cuts on you, you open yourself up to possibility of complications. Now, those complication rates are really, really low for most of, RSI-related surgeries. But they're not zero. So things like carpal tunnel surgeries, again, are very, very common. That's like a 10-minute surgery if you go to a hand surgeon. A lot of the time, they don't even need to put you under general anesthesia. Basically, you just get some medicine to stun you, and they numb the nerves that go into your hand and do your surgery, and you're done. But it is a pretty debilitating surgery because you can't use that hand for quite a while. Some people are really bold and have both of their carpal tunnels done at the same time, which is baffling because it means that somebody has to wipe their ass for them, and you must have really good friends if you can pull that off. But anyway, it is an option. It's very quick and easy. Other things like back surgery, obviously quite a lot more invasive and come with a higher rate of complications and problems and stuff. So those are a little more important to avoid than like a carpal tunnel, but surgical stuff is an option, and it does work really well for the vast majority of people. If you've tried all of the conservative measures and it's just not cutting it, your quality of life is affected, dramatically by this RSI, then, maybe it's time to talk to a surgeon. All right, so that's repetitive stress injury covered faster than anybody in the history of the world has ever done it. If you have anything to say, any questions, leave a comment below. Once again, I'm Milkman Al. Don't forget to like and subscribe. Hope you enjoyed the video. I'm gonna go get drunk and give myself the meat sweats. Have a good one.